Recently, I sat down with three women on the front lines from the administration: the president's top domestic policy advisor, Melody Barnes, the White House health czar, Nancy Ann DeParle, and I began with Secretary of Health and Human Services, Kathleen Sebelius, to ask her about the public fear of a towering $1 to $2 trillion cost. Can Americans afford it?
Well, Diane, what we know is that cost currently is crushing families and businesses. Unless we do something, we won't be able to afford the health care we have, the health care we need. We
went back and checked Medicare. And in 1965, everyone was told the projected cost of Medicare over 25 years would be $12 billion. And of course, it turned out to be $107 billion. And people think, there's no way this isn't going to cost a lot more, and that's going to mean more taxes.
I think people are thinking that this is brand new money that's being printed. There's already $2 trillion worth of health care that's being spent already. This is redirecting that money so that it's more efficiently and effectively used, and so that people are getting better quality health care.
But of course, that raises the phrase rationed care to everyone. And as we know, Newt Gingrich, who is probably the most vocal spokesperson for the Republican side, has been saying things like this.
If we have been endowed by our Creator with certain inalienable rights, how can a government bureaucrat tell you you don't deserve the best possible medicine, the best possible procedure, the best possible hospital?
They do deserve the best possible procedure and the best possible hospital. That's what the president's trying to guarantee
here. As the president said, there have been unnecessary CAT scans, unnecessary tests. Who's going to decide what is necessary and unnecessary?
Clinicians will make those decisions. When we look around the country, we see that there are areas where there's a lot more utilization, a lot more volume and intensity of testing, and unnecessary things.
And nobody's going to tell your doctor he or she can't do a procedure, but there'll be a set of protocols that we know at the end of the day actually produce a better result for you and are less intrusive. I don't know a single patient who, if they thought they could have one MRI instead of 3, if they thought, you know, a drug regime would work as well as surgery, wouldn't say, well, don't cut me open, you know, do what works best for me. And that's really what we're talking about, not cheaper medicine, better medicine each and every time.
There's one headline of this, then, to say to Americans, you will be healthier with fewer tests. Trust us? Is that what you're saying?
You bet. Right now, we pay doctors based on how many times they touch a patient, how many tests are given, how many procedures are run, not how well the patient is at the end of the day.
What percentage of American medicine, then, do you think is doctors doing unnecessary tests because they're caught in some cycle of unnecessary testing?
Well, there have been estimates that as much as 30% of it's unnecessary, but that's not really what this is about. What we're really trying to do, and the president's trying to get a system where we can have lower costs for all families and businesses.
Can't let you go without talking about prevention, because there are a lot of people who say, look, Dr. Mehmet Oz, for instance, says repeatedly, we want to be good Americans. Just come out and announce today that if you are an American, you have to walk 30 minutes a day. And that will cut health care costs probably faster than anything else we could do in the country.
That's right.
Right. I mean, we know that 75% of the costs spent on health care go to treating chronic diseases that are preventable, you know, heart disease and others. Some of that is about personal responsibility, but it's also making sure that there are incentives so business, and we're working with CEOs recently who came in and said, we're working with our staff to make sure that we're reducing obesity rates, that we're working on tobacco cessation. So those are the kinds of things we need to build into the system.
So financial incentives to the people who take care of themselves.
But this is something everybody can do. Parents can turn off the TV and, you know, walk around the block, walk around the room. They can encourage their kids to eat healthier foods. We've got to work with schools to get better food in the cafeteria and more physical activity.
So my potato chips are un-American.
Well, once a week.
Well,
Again, thank you.